Can you see the slide?
Yep.
Okay, good. First of all, we are very glad to have the opportunity here to present, and thanks for Mui's invitation. So today I'm gonna introduce our database named Taipei Medical University Clinical Research Database, and then Alex is going to tell us about our experience of the common data model mapping process. Okay. So Taipei Medical University has 3 affiliated hospitals. The first one is Taipei Medical University Hospital. Second one, Wanfang Hospital, and the third one, Shuanghe Hospital. And all of these hospitals are in northern Taiwan. And since 2015, we started to integrate the EMR database of these 3 hospitals to become one, so that we can have a integrated study based on this database. The composition of TMU-CRD, it combines various electronic medical records of these hospitals, including structured data and unstructured data. Structured data includes basic patient information, visit, test, examination, diagnosis, results, treatment, and surgery and medication. And unstructured data includes physician records, pathology reports, radiology reports, and discharge records. So totally we have 10 categories, 60 data sheets, and 2,350 fields, columns. And this is the list of clinical database data sheets. And we used linkage methods to integrate various data sheets. The overall time interval of the data covered by this database is from 1998 to 2020. Since 2008, the database has covered 3 hospitals. So usually we used the data from 2008 to up to date. So this database was linked to cancer registry and the death registry database. Those registry databases are held by the government in Taiwan. And we have achieved the therapeutic effects like response of drug, and also the progress, like the survival or recurrence, and also the side effects of anti-cancer drugs. And then we have also used the NLP to convert pathology reports from unstructured to structured data. And this is the example about the breast cancer. And then we also use the similar pattern to transfer the report for several other diseases. And the validation of the techniques for pathology reports are very high, over 99%. And the feature of our database include at least 6. First one, it has various taste results, like the severity of the disease. And the second, it has complete pathology reports, such as cancer staging information we can get. And then the hospitalization details, like the date for the process of the surgery and the examinations. And it also includes patient self-payment items, such as a health examination and new drugs, which was not covered, reimbursed by our national health insurance. And also we connect the days registration so that we can have the outcomes like the survival analysis, survival, and also progression-free survival information, which is very beneficial for the cancer study. Okay. And the suitable research types for using our database include several fields like the risk of diseases, outcome of diseases, effectiveness of drug, safety of a drug, and pharmacoeconomics, and also insurance policy research. We provide the service from the beginning to the end, include the title, research design proposal, a data application, data processing, analysis, and then we provide the results using the table and figures, and also to provide the service for the partners or co-workers in our university and also 3 hospitals. So here are some examples about using our database and to have the publication in the past. And then we also create the disease BI based on our database so that everyone in our hospitals can easily get the number of patients by using some searching keywords like the type of diseases and also the drug names or the ATC code, and also the examination or surgery code. The data, the raw data was provided by 2 types. One is release, and the other one is people needed to go to in the form, the room, and to use that. As well as cases, as well as the program, with only case number less than 5, greater than 5, and also greater than 1% of the total number of medical records in each hospital. Those data can be released to researchers. And we also provided 2 types of service. One is consulting, the other one is entrust collaboration by using the contract. That's it. And then Alex is going to share the experience about the common data model. Okay.
Hi, so my name is Alex. So I would like to share a little bit about how we mapping the data common data model in CDM from TMU database to CDM model. Okay, so here's our team member. So I would like to thank our teams in TMU to work on that. And of course, we understand the purpose of the OHDSI and the way of collaboration in studies. So that's why we try to, in the beginning, we try to mapping everything in the CDM model. And I think right now we use the version 5.2 in our CDM model in TMUs. And of course, I think I don't want to talk more about the benefit of that. So I think right now what we try to mapping is the first we try to mapping ICD to the snow mass, and another for the drug we try to mapping national health insurance drugs to ATC, and from ATC to ISNO in the CDM model. And later on we will working on lab tests, lab examination and procedure, and the other thing for the study purpose. So in here, I would like to show what we are already doing, meaning we already have care site, provider, location, person, and observation periods, disease occurrence, condition occurrence, and drug exposure. So those table we already map, and we pull the data to the CDM model already. And in here, these are some example of location detail, location. So what we have a location ID, and of course we have the description in Chinese as well. And this for CASA, meaning because the reason is different hospital, we have different department. So we try to store hold up the department belong to each hospital in the care size. Okay. And about provider, because in our TMU system, provider meaning the physician, they can do the cross system, meaning they can go to different hospital using the same ID. So it's easy for us to identify the physicians. And for the person, of course, the same as physician. So the patient, we also can cross different hospital. We can check the data if they go to see different physician or different department in different hospital. So that's why we can combine them together using person ID. And in here, the result of the observational periods. So follow the patient. So we have one of the visits for the patient during one of cross different database of the hospital. And the other is about visits occurrence the same. We also tracking inpatient, outpatient, and emergency of the patient if they visit different hospital. And I think this is some details. And for the drug, because Taiwan, we use our own drugs, our own drug codes. So and Taiwan government also provide the Taiwan drugs to the ATC. So in this mapping, we also try to mapping from ATC to ISNOM, and those drugs cannot mapping to ISNOM. We will use ingredients to mapping to ISNOM using the text mining way to map. So I think after we mapping that, we can try to open the mapping drug code from National Health Insurance, meaning they already open from the website. So we can open that to other site in Taiwan can use. So this may be the benefit for others. They can we can contribute to the OHDSI. Okay, and right now actually we already have we already built the Atlas system, so we can open to run the other study, and we can try to collaborate with others, a hospital or university in some study. Yeah, so I think here is we try to join the hypertension study. So hopefully we can finish and we can send hold of the result. Yeah, thank you so much.
Thank you, Alex and Jason, for the wonderful presentation. We have a couple minutes as well. Anybody got any questions for Alex or Jason?
So I have several questions. So do you include the note tables in the MOP-CDM from the original data set? Because you do have the very important and meaningful notes information in the original data set. So that's the first question of mine.
Actually, in our data set, right now because we try to join the hypertension drugs study, so we only mapping some specific information first, and we try to improve that later on, because we cannot in the first time we will map everything. So we will, step by step to map that. Yeah,
thanks. And the second thing I want to say is that as I say in the OHDSI APAC steering committee meeting 2 days ago, that I want to show more, I want to proceed more small, successful.
Is it me or did we lose Chan?
I think
too.
Me too. Oh, Chen is back.
Okay.
Chan, you're back. We lost you at small.
Yeah. So yeah. So I'd like to have several small successful stories in APAC network. So if you have any clinical questions to answer, or if you have any clinical ideas to aboard the study, then please let me know that to help you and to lead the OHDSI study by year one.
Thanks.
That's it.
Oh.
Exactly. Apart from showing the international collaboration research program, we will also like to initiate new studies. Like recently, we are gonna have a lung cancer research, and hopefully we can provide the proposal first, and then to see if you guys want to collaborate with each other, in the future.
Great. That's it.
Awesome. Any other questions from anyone else? Nope. All right. Well, I just want to bring up that in 2 more weeks, we have 2 other presenters. So please come and join us for that. We have Professor Yuan, I believe, from who's going to actually talk about the hypertension research paper, or the research project that Jason and Alex just mentioned about, and where we are at this current stage. She's going to talk about that, as well as we have a doctor from China, Dr. Feng Lei, who worked on an OHDSI study, and he's going to showcase basically what his research study is about. So that's what's going to happen in 2 weeks from now, and I promise we will clean up the confusion between the meetings before then, okay, and send everybody the right link. All right, well, thank you everybody for joining us. Thanks for those who stayed up late. Thanks for everybody else's time during their busy days. So we will see you guys in 2 weeks.
Awesome. Thanks, everyone.
Thank you.
Thank you.
Bye bye.
Bye-bye.
Bye. Cheers.